Have you ever walked out of a nursing exam thinking to yourself, I knew that, so why did I still fail? You're not crazy. Nursing tests are not designed to see if you have the right facts memorized. Instead, they're testing how you think, whether you can reason like a nurse when you're under pressure. And that right there is why so many smart, hardworking students keep getting tripped up even though you've been studying for hours and hours. Here's the problem. You've spent your entire life studying for straightforward test questions. You memorize, you recall, and you're done. Although, to be honest, you probably brain dump before you're done. But nursing exams are a different beast because every answer option technically looks correct. Because they sort of are. Usually, every answer option is something that you would eventually do in that situation. But the question is, what is the priority nursing action? Which action comes first? That's what your nursing instructors mean when they say you have to learn to think like a nurse. But no one actually teaches you how to prioritize beyond use the ABCs, use Maslow's, think about safety. And that's not good enough, not if you want to become a successful nurse. Let's look at a real example that I had when I was in nursing school. A patient just ran out of a burning building. Their clothes are smoldering and they have char marks right underneath their nose. Then the question asks you, what is the priority nursing action? Now, most nursing students identify that char mark underneath their nose and immediately start thinking about a possible airway injury. After all, that is one of the first indicators you would memorize in your med-surg class when you're studying that topic. So it makes absolute sense that you'd jump straight to the ABCs to prioritize. Airway, breathing, circulation. And you'd start looking through the answer options for something like secure the airway or to administer oxygen. Something that reflects that we're going to be doing something for their breathing. Now, as I said, this was a real question I got on one of my nursing school tests way back in nursing school. And about half my class got it wrong because they used the ABCs to answer it. The half of the class that got this question correct managed to do that because they slowed down, thought like a nurse, and recognized that there was a much bigger problem that needed to be dealt with before the ABCs. The patient's clothing was smoldering. That means they're still on fire. And half my nursing class was about to slap an oxygen mask on them and then start administering a flammable gas. So in this particular situation, we would want to put out the fire on the patient's clothing and then administer the ABCs. And that's a perfect example to the common trick behind questions like this. All of the answers are something you would eventually do, but they're not all the right thing to do first. Which means you can't prioritize the answers until you prioritize what framework you're going to use for your decision-making first. In this question, ABCs weren't the priority framework. Safety was. And it's only once safety is assured and the fire is put out that we can shift to managing the airway. This is what I mean when I say that nursing exams are not about memorizing the right acronym or even knowing the right test-taking strategy. It's about navigating and understanding the why behind each thought process. And that's exactly what I tutor you how to do using my Silver Bullet study system. It teaches you to understand the why behind every question, behind every framework, and behind every nursing priority, so that you can finally think like the test instead of fighting against it. Because nursing school doesn't reward memorization. It rewards critical thinking and clinical judgment. If you're ready to start cramming facts that you're only going to forget tomorrow, and instead start understanding nursing on a deeper level, comment with SBSS down below, and I will send you a free overview of the system. You don't need to do more. You don't need to study harder. You only need to study better, because that is how you pass your exams and get your joy back in learning.